and welcome to Let's Just Do This. I'm Margaret Wallis-Duffy, and I'm thrilled to be sitting next to my co-host, Mr. Todd Miller.
I'm thrilled to be sitting next to you every week.
Indeed, indeed. And as all of you know, we are here to make change happen by bringing change makers to the table to really talk about issues that are near and dear to the heart of all of us, the health and well-being of each and every one of you and your family. And so today I'm really honored to have two people sitting across from me who are both from the Patient and Family Advisory Council with the Ontario Ministry of Health and Long-Term Care. So first, I'd love to welcome Julie Drury, who is the chair of this council. She is passionate about patient-family professional partnership and experience in health. Her professional role, she facilitates and provides the patient and family perspective in healthcare policy and decision-making. As a mother of a child who was diagnosed with SIFD, a rare form of mitochondrial disease, Julie has a particular experience in system navigation, complex care, care coordination, palliative care, and patient safety. Her leadership of patient-family advisory councils inspires her to mentor families on the navigation of the healthcare system and to advocate for the role of patients and families in the healthcare system, which is an absolute passion of mine. Welcome, Julie.
Thank you. Thanks for having me, both of you.
And there's so much more we will talk to, but we also have to introduce this other wonderful human being sitting next, who I also get to call my friend. I've had the pleasure of knowing Mario Lopez for many years, as he was a tireless, amazing coach for my son in hockey, but has his own story that he's bringing to the table today. Mario was appointed by the Patient Family Advisory Council. He's a law clerk and is a legal assistant from Humber College. He was diagnosed with hemophilia at the tender age of just 3 months. Mario has relied on the healthcare system. He's keen to provide the minister's Patient and Family Advisory Council with meaningful insight from his own lived experience as a patient. Mario has a great appreciation for how important it is to have equitable healthcare services that are transparent, safe, accessible, and efficient. You know, Mario, I've known you for many years, and to see you in the role as a part of this council is so deserving, and I'm honored to have you on the show.
Thank you very much for having me, both of you.
So before we get started, Julie, I think it's really important to explain what this council is meant for and why you've been chosen as the chair. You've got an impressive resume that I couldn't even read all of. But why is it so important that we have this council, and what is your job?
You know, I think patient engagement is something that's been evolving over the past 15, 20 years. I think it started very much actually with some of the issues that Mario might have faced in his healthcare journey. And what strikes me about this council is that this is a ministerially appointed council. It's the first time ever in Canada that there's a council of patient and family with lived experience in the healthcare system that are advising a minister of health and a ministry of health. So they're building on the lived experience of the people who are in the hospitals, in the long-term care homes, who are experiencing health with their family doctor, their pediatrician, their geriatrician in some instances, and they're figuring out what is working and what is not working for Ontarians in the healthcare system. What brought me to this role? You know, second part of your question, I have a long sort of history of experience with the pediatric healthcare system. So as you mentioned, my daughter Kate had a rare mitochondrial disease. She went undiagnosed for close to 4.5 years. Her condition was identified through genetic exome sequencing, which at the time was very expensive and a long process, and now it can be done almost a day for a much smaller dollar value. So we really saw the evolution of the healthcare system with Kate. We were through many different layers of the healthcare system, and through the course of my journey with her, I spent a lot of time doing advisory work, working with our children's hospital, working with the province, chairing councils such as this one, and I think it naturally led me, with my background in health policy, into this role.
Your story, and I've read your blog, and I encourage all of you out there to read your blog. It is really some impassioned work that you're doing, and we're really grateful to have you here.
Well, thank you. I'm really honored to be here.
So Mario, Could you tell us a little bit about your story? I mean, we're talking about patient advocacy and patient-centered care and having the voice of a patient heard. Could you tell us a bit about your story and why this role that you're playing on this council is so important to you?
Absolutely. I was diagnosed with hemophilia A severe, the tender age of 3 months. For those of you that don't know what hemophilia is, I'm lacking a blood protein in my blood that enables the blood to clot. So I'm on factor VIII, and that's a medication that I infuse with intravenously to enable my blood to clot. I've had many hospitalizations and procedures and surgeries over the years. And what's happened in the past is I've had some pleasant and some not so pleasant. I have a great hemophilia care team at St. Mike's. They understand me as a person. They understand my illness. And they actually take great concern in my opinions. So the not so pleasant side, about 10 years ago, I was on the ice and I managed to break my hip. And an ambulance was called. And they rushed me to a hospital in Peel. And at that point, I called my wife on the way and let her know what had happened, explained the situation, and I told her to bring my factor VIII medication to the hospital because in those days, what happened, and I'm sure it still happens now, is they always want you to see a physician first before they administer any medications. Mm-hmm. So my wife arrives into the emergency room, and she proceeds to bring me in my factor VIII. And I actually start taking it out of the packages, and I start mixing it up, and I was infusing my factor before any doctor had seen me or before any x-rays had been taken. Finally, they come up with a diagnosis, definitely he's broken his hip after I had x-rays. So they take me up to a room on a different floor, and they admitted me. And the doctor came in and indicated that we're going to take a look at what we need to do, and we'll get back to you. Well, that doctor never came back. I asked to speak with him several times, and he never came back to see me. He proceeded to tell my wife, because he wouldn't speak with me, that if he operated, I would die on the operating room table. I made some calls to family and friends. They were actually going to come and pick me up and carry me out of that hospital and take me to St. Michael's. In the meantime, I called my nurse coordinator at St. Mike's, explained the situation. She contacted the hospital and spoke directly to the physician. I really didn't say spoke to the physician. She tore a strip off of him. Told them they were arranging a transport to pick me up. Transport picked me up in the afternoon. I was at St. Mike's an hour later. They hooked me up to an IV with my factor VIII drip. Went down for x-rays. I came up. They put a sign on my bed that indicated no food or drink. I was in surgery the next morning, and I was out of hospital 3 days later. That's astonishing and concerning at the same time because I would like to have confidence that whatever hospital they bring me to in this province, I should have the same level of care.
Mm-hmm. Mm-hmm. Julie, being the chair on this committee, what does that mean to you? And what can people and what should people at home understand about the role that this council has and the role that it needs to play in hearing the voices of patients across this province, just like Mario?
You know, the value of this council is exactly what Mario represents. It's the lived and living experience from across Ontario. So the Ministry of Health were the ones who sort of conceived of the council and brought forward the council members. I had an opportunity to veto or to accept members once I was brought on as chair. My role was a competitive process. The council members were selected based on interviews. And they represent all the regions of Ontario. They represent rural, they represent urban, they represent lots of different lived and living experience. Pediatric in my case, Mario has firsthand experience. Other members who have experience with caring for a family member or a loved one, and different types of healthcare experiences. Their value is that they're reflective of Ontarians. They're not representative because we can't represent everybody, but they're reflective.
Right.
The people at the table have a real skill set, too, of having a real broad approach to looking at the healthcare system from many different angles. So they're bringing in not just their lived experience, they're bringing in their professional experience, they're bringing experience as hockey coaches and members of the community, they're bringing experiences of other people they've met along the way. And they're thinking at a systems level. So this is the first time we get to talk as patients and families about what's happening when we develop health policy in Ontario, and what do programs look like, and how do we determine which program is more important than another, and how do we help the Ministry of Health and the leadership within the Ministry of Health understand that there might be some gaps in the policies they're developing, and there might be some opportunities of shaping things a little bit differently so that scenarios like Mario's are perhaps addressed. His is a continuity of care situation. Had he gone to the hospital where they knew him best, where his healthcare team was best positioned to care for him, he might not have had the seriousness. And I think something we want to walk back and talk about a little bit later as well is about that patient engagement piece. Mario was an advocate for himself. He knew his condition. He was an expert in his chronic condition, and he wasn't listened to, and wasn't valued, and wasn't respected. That doesn't happen often, I don't believe. I think we have amazing physicians in Ontario. I think we have great communication with them as patients and families, but I think we can build upon that. And I think it's a clear example where when that doesn't happen, it can really fall apart quickly, and it can jeopardize the health of an individual living with either an acute situation or with a chronic situation such as Mario's. Certainly we experienced that in our healthcare journey with our daughter, and those are the types of things as a council and as a chair that we want to address.
You know, this is music to my ears. For 25 years working at my clinic in an integrative health focus, before it was cool to do integrative health, or not even just cool, before people really understood what it meant to truly break down silos and work collaboratively, putting the patient at the center. You said so eloquently that Mario was the expert on his own health. I think that's a powerful thing to say, coming from a chair of a ministry council, because I too have my story as a health, my own health story, which is why I'm so passionate about this. And I think hearing that and you so candidly saying that really does help to empower patients to have a voice. And you're saying that there's actually, you're wanting and asking for these voices to be heard. Is that what I'm hearing?
Absolutely. We have our council, which is right now 9 members. We'll be up to, we hope, 12 or 13 members for our next meeting, and next weekend, actually. And eventually we'll have our full complement of 15. But we've also introduced what we're calling a virtual pool of advisors. So there's over 1,200 people that applied to be on this council from across Ontario. We've gone back and we've asked every single one of them, we want you to stay involved, we want you to stay engaged. Can we reach out to you virtually? And the ministry has done that several times over with our patient engagement leadership team within the ministry, a team of 4 who are incredible. Mary's met them all. And they are helping to do the work of the council and myself within the ministry, and helping to manage things like the virtual pool, the council, to bring our ideas forward, but also to help those within the ministry understand what patient engagement means, how to bring in the patient voice, how to bring in the patient perspective, that it doesn't just happen at the end of developing a policy when it's fully baked and you ask us, so what do you think?
Right.
You involve us really early on in co-design, in steering committees, in focus groups, and we're really challenging that within the ministry right now. The really good news that I want to tell your viewers is that it's being so well received. There's no one turning us down. There's no one saying, and we don't want to listen to patients and families. They're actually competing to see who can come to talk to us first. Nice. And they're really very interested in it. And it was happening before we came on board. There were other tables in place of patient and family advisors. We're just enhancing that now, and I think trying to bring some continuity to it and also bring some long-term aspect to it as well.
How did you ensure when you were putting the council together that the people were there prepared to work on solutions and not just use it as a sounding board or a way to complain?
I think it's maybe a little bit of a fallacy that patients are just there to complain. In general, patients have their stories, good and bad and challenging, but they're looking for solutions. Yes. And they want to help. And they want to help by sharing their stories. We do a lot of patient storytelling within the ministry, and Mario's been a part of that just recently. And it's a real opportunity for our senior leadership to reflect on what's working and what's not working, and to hear it really firsthand. We do some coaching to answer your question more directly, so our patient engagement team work with our council members, and they work with anyone who's going to be coming in and sitting down with the ministry leaders, and to help them understand how they can get involved and how they can engage. We do some coaching as well and some preparatory work.
We have so much more to talk about.
Yeah, we do, yeah.
It is so exciting to hear that this work is actually happening. So we're going to be right back. We're going to take a quick break. Stay tuned, because we've got more coming your way about this incredible council that we're here to talk about. Stay tuned.
Welcome back to Let's Just Do This. I'm Todd Miller, along with Margaret Wallis-Duffy and our wonderful guests, Julie Drury and Mario Lopez. And we're talking about the Parent and Family Advisory Council for Ontario. I had a question about how the council is actually structured. So you have an in-person component, and you also touched upon briefly about having a virtual component with other people chiming in. How is it structured across Ontario?
Right. So it's important to say that the council itself are all members who are ministerially appointed. So they've gone through a very significant and extensive process to be at that table, including myself. We also have the virtual pool, which was everyone who applied. And I mentioned there was over 1,200 people. We managed to retain over 700. So over 700 people are responding to the ministry in the form of surveys, focus groups, questionnaires. Sometimes the ministry is going to them and sort of pulling people out of the pool, actually physically, and having them sit at the table with them.
Amazing.
And they're really getting an amazing richness of information. The other piece that's happening across Ontario is every local health integration network. So every LHIN, who are the organizations that deliver our home care services, that structure how our hospitals are going to work, that deliver the resources and funding within the regions across Ontario, they are all now required under the Patients First Act to have a patient and family advisory committee. And those are all in place. Yeah, those are all in place this fall. And so we've brought together a little bit of a governance structure around them. So I'm now chairing what we're calling a provincial PFAC, is what we call our patient family advisory committees, a provincial PFAC leadership table. And this leadership table will have in-person meetings with options to teleconference in. It's composed of all patient advisors. So it's the chairs and the co-chairs of those committees across the LHINs, and it's the patient advisors, not the staff from the LHINs, it's myself and the advisors. We're going to talk about challenges, opportunities, what's working in your region, what's working in mine. We're going to talk about the priorities happening in the ministry, and Mario and the council are going to be working very hard in the next weekend or so to help establish what our work plan is going to be for the next year and a half. Wow. We're going to be able to share that back to that leadership table and identify what do we want to be working on as patient advisors, what's important to us as Ontarians with lived and living experience with the healthcare system in Ontario.
Amazing.
It's exciting.
It's so exciting. And
is.
as a healthcare professional and a patient with my own story, it's just gives me hope, you know, with my commitment to integrative health and to really breaking down the silos and working together collaboratively. That patient voice is so critical, and that family voice is so critical. Mm-hmm. We all have those stories to share, and to hear that this is, you know, really happening across our province. I'm so honored to have you at this table sharing this with us. Mm-hmm. It's just incredible. Now, Mario, from your perspective, sharing your story already, I know that Julie had mentioned that you had already shared some of your personal experience. Right. How was that received, and what did that feel like to you as a patient? You're playing such a pivotal and important role in having your voice heard, the collective voice. But what was that like for you as a patient?
It was absolutely incredible, actually, just to be able to present, first of all, to the executives at the ministry, and then listening to me, and then one of them individuals turning to me and saying, "I've never seen such a silent room," and just taking it and being engaged with me and asking me questions on what I felt, and is there anything that could be changed now? What could we do better?
Wow.
It was amazing. It was just a fantastic opportunity, and I took advantage of that.
And yeah, and having, you know, I've known you for a long time, and you've never been sort of a shrinking violet kind of guy. You have your voice heard. But what I love to hear as just a real human being, mind, body, and spirit, for you to just say you were heard. You know, there's often councils and people hear that things are being done within the government. What I love about what you're sharing, Julie and Mario, is that there's real action attached to this conversation. And it's coming also from the voice of the patient at the center. And I think that makes it, unique. You said this is the first time this has happened, and the value in that moving forward and the learning that can come from that is just exceptional. So it's really neat to hear that experience from you directly as a patient.
Yeah, and I think it's just a dynamic shift, and I think everything in healthcare is becoming patient-centered.
Yes.
And that's where it should be.
Right. Your experience in working in policy for years, with this committee, what is your feeling around how this council is going to be able, and your background with policy, in making actual changes moving forward? Because that's really what everybody at home wants to hear. We're excited to hear about what's happening. We also want to know that there's going to be change attached to that, because that brings us all hope.
Yeah. So change takes time. I'm not
Yes.
going to lie, especially
Of
within a
course.
bureaucracy. I used to joke, I come from the federal government world, and I used to joke that it takes about 20 years of rolling the boulder uphill to get anything to happen. I'm hoping it won't take that long. My husband's a builder, and he said to me driving to the airport the other day, "What's the end game here? What are you doing?" And I kind of took a moment and thought, we're doing policy work, so there's no end game. It's going to go
Right.
on forever. But really, my end game over the next few years, the 3 years of my mandate, is to really establish patient engagement, patient experience, lived and living experience, patient and family-centered care, to establish it within the Ministry of Health. So what does that mean? We have to make it part of the accountability frameworks that the senior leadership respond to. And they're receptive to that. They've said, okay, let's do that. We want to make legislation, we want to make policy, we want to make regulations. Let's talk about how we can ensure that patient engagement is the focal point for all of those. So we're having that conversation. I have a real nose for tokenism. So being sort of pandered to is something that I'm sure Mario, I see him nodding in the corner of my eyes, senses as well. I don't feel tokenism, and if I do, I let them know. We're really feeling like we're not being heard. We're really feeling there's something here that's of importance that we need to see a shift or a change in. I don't have in my role the opportunity to make decision, and I don't have the opportunity to identify dollars in the budget as to how I think things should be spent. It's very much an advisory role, but again, I really feel like we're being heard, and so the changes that people want to see around system navigation and care coordination and continuity of care and access to your health information when and where you want
Yes.
it, having
Yes.
a family doctor, having a family health care team to look after you, those are the things that we're talking about and that we're trying to hold the ministry to account when it comes to patient and families.
That is music to my ears and to all of us, because you're right, and change doesn't happen overnight. And I always say, whether it's at these tables here at Let's Just Do This or any of the documentary work that we're doing, to have a patient voice and to bring healthcare professionals together collaboratively, it takes time and it doesn't have to be perfect. I always look at wanting to see the paradigm of thinking shift a little. What's exciting that I'm hearing is that you're saying it's already being received and receptive. What do you think, and you may not have the answer to this, Julie, but what do you think has changed, even through your course of your career and your experience with your healthcare and your daughter? Why is there that reception now to hear the patient voice? Why do you think that is?
Well, I think first and foremost is that many patients and family members are becoming more aware that they can speak up, that they can ask questions, that they can have a conversation and a dialogue with their doctor, and it's not just what the doctor says and I'm going to go off and do it. We're becoming more savvy. Is that because of social media? Is that because of the presence of the internet? Is that because we're all Googling for health information? I think it's a combination of all of that and sort of how we're evolving as a society, right? We're not that we're entitled. I don't think that's the right word, but I think we're more active and we're more we're stronger advocates for ourselves. Yeah. So I think that's the first piece of it.
You know what? And I'm glad that you said that, because I also believe that, doctors in the healthcare system can only do so much, and we also have to invest in our own health and take ownership. Well, part of that ownership piece is having your voice heard in a respectful way, in a transparent way. As you've said, you want your voice to be heard. That is so important, and the two working together, us as our own advocate and having a voice, and the healthcare system being willing to hear it. It is different, and I'm seeing that when I've challenged my own healthcare professionals that are working on my team. I'm part of that team. But I love what you're saying, that we have to both work together. The patient has to be their advocate, as Mario is so brilliantly doing. But we also have to feel like we're being heard, which it also sounds like that this isn't just a token, that you are actually being heard.
It does feel that way. It really does. It's a great opportunity. And I think that, as I said previously, there's going to be a dynamic shift. I truly believe that. And you can see it just across the whole spectrum. So it looks really good.
So just to wrap up, because I'll tell you, these shows go too fast when we have amazing guests like you both on, and I hope that you'll come back, because it's been an honor to be able to share this with our listeners and viewers, and because it's exciting what's happening here in Ontario. Julie, is there anything else you want everyone to know, or to remind them how to get involved and have their voice heard, or what resources of support are out there for families that need the help?
Yeah. In terms of getting involved, definitely our virtual pool, we're really promoting that, because I think there's a lot of opportunity there from the ministry level or even from our local health integration networks to get involved. So I know you've got that website up on the screen. I'd also encourage people to get involved in their communities. So be it your home hospital, who hopefully has a patient and family advisory committee, and if they don't, maybe you want to get one started. Your long-term care homes, getting more involved if you're receiving home care and asking questions and understanding what that means and what's available to you. Creating that conversation with your physician or your nurse or your care coordinator, and letting them know that you want to be a partner in your health, that you want to have that conversation, you want to have that dialogue, you want to learn how to advocate for yourself a little bit. I can guarantee you 99.9% of the time, the physicians, the nurses, the care coordinators, they want to be involved in that collaborative relationship as well. This isn't an adversarial thing. This isn't patients having an uprising and saying, we want to be in charge. It's really very much about communication and kindness and compassion in the system, and understanding that there are people who have lived the healthcare system very intimately through many different aspects, who have a level of knowledge and expertise that is really going to enhance our healthcare system. It's going to change how healthcare is delivered so that it's better for the other people coming along behind us.
Fantastic.
So brilliantly put. Thank you so much for coming and sharing the work that you're doing. We're honored to have you here at this table, and at Let's Just Do This and WOW New Media will continue to link arms with councils like yours, the community at large, the LHINs, so that we can really educate, empower, and inspire everyone to live better together here in Ontario. Thank you for joining us.
Thanks for having us.
Yeah, thanks for having us.
For more information, visit the website that we put up, and please do get involved. We want to hear your voice. On behalf of the Your TV team, the Let's Just Do This gang, both Todd and I, from the bottom of our heart, live well together, and until next time, be well.